Welcome back to Beyond the Crime, the podcast that takes you into the minds of criminals with your hosts Dr. Lars Madsen, Shay Addison, and Dr. Rob Brockman.
Welcome back, everyone, to Beyond a Crime, the psychological analysis, which is a podcast where we look at forensic schema therapy and its application to clinical contexts. Now, in this special edition of Beyond a Crime, I'm here with Stan Steindl. Stan Steindl is a clinical psychologist and an adjunct professor at the University of Queensland, and he also runs a fantastic, or has a great podcast called Compassion in a T-shirt, which I was on last year along with Shay Addison. And Stan is a great proponent and academic in relation to compassion-focused therapy, which I'm hoping that we're going to have a great discussion about today, and considering that the populations that we work with in the forensic space often struggle with compassion both towards themselves and other people. I'm really looking forward to sort of learning a little bit more about this approach and seeing how it can be applicable to both to forensic context, but also to schema therapy. So welcome, Stan. Thank you so much for coming on our podcast. And it's great to see you again. And it's always lovely catching up with you because obviously we go back, well, I mean, it's almost 25 years now, isn't it, as well?
Exactly. Well, yeah, Lars, thanks. G'day. Very pleased to chat with you on Beyond the Crime. I am a fan of your podcast, so I hope I can make a bit of a contribution. But yeah, I'd love to dive into CFT, forensics, schema therapy. Yeah, very keen to have this conversation.
That's great. Now, it's probably a good place to start if you can kind of set out for us a little bit about what is CFT, compassion-focused therapy, and what are the key concepts and goals of CFT?
Yeah, sure. Well, CFT was founded and developed by Professor Paul Gilbert, who is a clinical psychologist and researcher in the UK, originally at University of Derby, now at the Compassionate Mind Foundation. And it really what happened at the beginning was he was a cognitive behavioral therapist, I suppose, but also drew on various other approaches. But he sort of started to notice that in cognitive behavioral therapy, people could often challenge their thoughts quite effectively, but challenge them in a way that might still come across with a more difficult, critical sort of a tone. So don't be silly, of course people like you, or something like that. They'd be challenging their thoughts, but they weren't feeling any better. And he really arrived at the importance of tone, I suppose, the tone in our self-to-self relating, and started to think, how can we not only shift the content, but also the tone of in amongst all of that. He started to explore caring, and then he started to move towards this notion of compassion and how to cultivate compassion for oneself, but also compassion across a few different flows, self-compassion, but also compassion for others and receiving compassion. And then what happened next really is he developed this very broadly integrative model of the mind, and in particular evolutionary psychology, the notion that we've evolved with these kind of tricky brains, I suppose he would say, that really are designed for us, not by us. We have these brains, they're designed to help us survive and survive long enough to reproduce, and then to survive long enough to raise our offspring and so on. And so he started to explore the way that these tricky brains, while very adept at helping us to survive as a species, also become a source of suffering and things like anxiety or anger or sadness, or even other things like self-criticism and shame and those kinds of emotions. They're all sort of built in, and they kind of technically do help with human survival and survival of the species, but of course, yeah, create a lot of pain and suffering. But the clincher, of course, is that compassion also evolved as part of our species. It's this idea that, a big part of how we perhaps survived over the millennia and so on is just by being able to be together, be connected, belong in groups, look after each other, be helpful. Definitely our very vulnerable young and so on, but there's sort of all sorts of archaeological evidence out there that really suggests that we've always kind of cared for each other, our young, our old, our injured or disabled. There's sort of evidence of human remains from tens of thousands of years ago where, there's kind of, I guess, medical condition there that the person would never have lived as long as they did without being looked after, without having food brought and water brought and that sort of thing. So that's where he sort of landed on this notion that compassion is part of our brains too. It evolved as part of our characteristics and function in life, and so CFT then became an approach where we started to try to, can we take advantage of that? Can we bring that compassionate mind to our suffering and try to sort of alleviate and prevent suffering in ourselves and others and so on. That's a bit of a snapshot, at least, of the beginnings of it.
Yeah, it certainly makes sense that compassion or being connected to other people would be something that would have evolved in people. I mean, otherwise, how do you kind of work together in small groups and not stick up for each other, but help each other out? How I'm curious, how does I mean, this feels like a very abstract concept as we're talking about it, but I'm sure it isn't. How, when we talk about compassion, I mean, firstly, how would you define it? How is it defined within CFT in terms of how is that different from, say, empathy or sympathy, I guess? What's how's it defined, and how do we operationalize that in therapy?
It is an interesting point. I mean, it is kind of an abstract idea in some ways, and in some ways, people vary in how they might think about what compassion is, and in some ways, that's one of the little challenges in CFT is to sort of really get a shared understanding of what we're really talking about when we're thinking about compassion. So compassion is a sensitivity to suffering in oneself and others with a commitment to try to alleviate and prevent it. So there's quite a lot in there. First of all, it's a sensitivity. So it is about being able to notice and be aware of suffering. And it's in self and others. So right in the definition, we're talking about compassion towards the self as well as compassion towards others. And then it's a commitment. So one of the key things that I think Paul Gilbert would say is that compassion is a motivation and a commitment. It's a motivation to engage with suffering and be sensitive. And then it's a motivation to try to alleviate and prevent it. And so that's the kind of the action part of the definition. We're sort of trying to take wise, helpful action to alleviate the suffering and perhaps prevent future suffering. But, that's tricky too, in a way. Sometimes we might make certain choices or take certain actions that perhaps feel tricky and difficult to begin with, but is designed to help prevent suffering down the road. I mean, each evening I try to go out for my walk, my daily walk, but I've got my smartwatch that, kind of keeps me honest. And I'm not sure if my smartwatch is my compassionate friend or my slave driver. But anyway, the idea is that it's not comfortable to do it. Like if I could just sit on the couch and eat ice cream and watch Netflix, I'd rather do it. That would feel good. But compassion is often about trying to do things that we know are good for us in a way, and especially, in that sort of longer term preventing suffering sort of thing. So, yeah, compassion is a sensitivity to suffering in self and others with a commitment to try to alleviate and prevent it.
So what you're describing there is that almost like it's not what you're saying. It isn't just about. It's not warm fuzzies all the time. No, that it is. Sometimes you got to do hard stuff that feels difficult, but it's kind of connected to like a longer term sort of goal in that this is going to be good for me. When we're talking the example of it's good for me to do exercise for all kinds of reasons, but I don't necessarily want to do it right now, and it doesn't feel nice when I'm doing it in the moment. Yeah, so that kind of captures that idea. Is that longer term perspective, that why
Longer term,
there's a sense of wisdom to it, isn't it? Like that's what you're saying. It's almost like a wisdom to compassion as opposed to just um, you know, saying nice things or warm fuzzies all the time, isn't it?
yeah, I think this is the key, is that we spend a bit of time in CFTs with our clients or people we're working with, kind of exploring compassion and what it is and how we might think about it or how we might operationalize it. Because sometimes people do initially feel like, well, compassion's just being nice, or compassion's just sort of feel good or warm and fuzzy, or sometimes people even worry, compassion is just, or self-compassion is a bit self-indulgent or a bit self-pitying, or so there'll be a range of sort of ways that people might conceptualize compassion, and we spend a bit of time kind of exploring it, because actually compassion really involves wisdom, as you say, tapping into the wisdom about what might be helpful, rather than harmful, and what might be in the service of our health and well-being. So there's wisdom there, but there's also strength and courage as well. In fact, often courage is the key when it comes to compassion. The courage to, well, firstly, be sensitive to and approach suffering, and then secondly, to take the action that might alleviate or prevent it. So wisdom, strength and courage, and then of course just this caring commitment, just
Mhm.
this sense that we're sort of committed to the notion of being caring, supportive, helpful, encouraging in our actions and so on, and certainly trying to not be harmful or in that sense.
I can see the courage thing is really relevant, isn't it? Because it's some because it is I suppose going back to that longer term goal, the fact that you would have for yourself maybe, but also if you're sort of engaging in being compassionate towards other people, then sometimes the courage would be around having to set limits, wouldn't it? On people, having to hold people accountable for maybe thoughts or behavior, that kind of thing.
Mm.
It's in there if we think that this is what they need and this is ultimately in the betterment of the suffering that they experience. Yeah.
I think there's two halves there that we sort of come to at about this point, and it's a lot about the evolutionary theory behind it, I think, and that is that given we've evolved and given we have tricky brains and we're sort of born with a brain that was designed for us and not by us, and also that we just through no choice of our own had certain strengths and weaknesses, that we might have been born with as well. Given all of that, our suffering and our behaviours and our choices and so on, they're not our fault.
Hmm.
And the key there is really trying to explore a sort of a de-blaming, de-shaming way of people being able to see themselves or to see others as well. That for example, if someone's hurt me, we might tap into this idea that they have tricky brains, or they were born with the brain that they got without being able to choose, and so it's not their fault. But that's the first half. The
Okay.
second half is, but it is my responsibility. I'm able to learn about the brain and the mind and how they work and the way that it's tricky and the certain various kind of sort of old brain and new brain functions that might be at play. And if I can sort of learn about that and understand that, then I can start to make other choices that perhaps are more in the direction of being helpful rather than harmful. And so it is a little bit, yeah, it's not my fault, but it is my responsibility. So no shame, but responsible or just the opportunity really
Mm.
to, make different choices.
Mm. Yeah. Okay. You mentioned the different emotional systems that the CFT maybe focuses on. I think threat, drive, and soothing. Is that right? Can you tell us a little bit more about how these might interact? And also, I guess I'm really interested in how that kind of looks in the session in terms of when you might be explaining it to a client or working with someone using these concepts in a practical way
Yeah.
with someone.
This is a sort of a beloved kind of little model in CFT and really makes a lot of sense conceptually, but it's very practical as well to be thinking. We call it the three circles model or perhaps the three emotion regulation systems. And it's often things that people are sort of, sometimes quite familiar with. I mean, the first system or the first circle is the threat system. And often people are aware of this from the point of view of the fight flight response. Or sometimes we might think of it as the fight, flight, freeze, appease response. Or
Yeah.
sometimes people say fight, flight, freeze, fawn. I think it depends whether you prefer alliteration, which would be fight, flight, freeze, fawn, or rhyming, which would be fight, flight, freeze, appease. But anyway, it's this idea that when the threat system is activated, we have a kind of a threat protection, safety seeking motive. That's what's behind threat system is a threat protection and safety seeking motive. And so fight, flight, freeze, appease might be just these different ways that different behavioral responses and physiological responses that might be in the service of that threat protection motive. And the emotions too might help sort of energize or drive that motive. And so we might have anger and anxiety, sort of fight, flight, or
Mhm.
we might or disgust is sometimes too thought to be in the threat system. And so the first circle is kind of threat system, and it's a sort of a better to be safe than sorry system. I
Yeah.
mean, you can imagine in an evolutionary sense and a survival sense that the threat system had to be pretty automatic, had to react quickly. If there was a lion stalking us over there, then we weren't wanting to just look at the lovely sunset or something. We wanted to look at the lion and respond,
Yeah.
kind of quite quickly. And also, we would sometimes prefer to err on the side of seeing a threat that maybe isn't there than ever missing a threat that is there. So the threat system can also be very reactive to perceived threats or to things that maybe are reminiscent of threat, even if, in the end it turns out not to be. We might be like, oh, a snake or something, and then it's kind of like, oh no, it's just a stick. That's okay. So the threat system is threat protection and safety seeking. It's very automatic and reactive, and we sort of err on the side of seeing threats that might not be there than ever wanting to miss one. So that's the threat system. The problem with the threat system, I guess, in a way, is that if it had its way, we would be stuck hiding in the cave or something, and we had to get out of the cave. We had to go and get stuff. We had to find food or resources or find a mate or that sort of thing. So
The
the
threat system,
second,
would that also be like it sounds very much like that when we think about schema modes, like the overcompensating modes a lot of the time is the modes where the people get on the front foot and they fight. There's a reaction to things, and then there's like these habitual responses that start to develop over time and to become their habitual go-to sort of way of dealing with threats. Yeah, yeah.
yeah, yeah.
Absolutely.
If we think about threat system, yeah, that there's I suppose I said before that we have tricky brains designed for us, not by us, and we're born without getting to choose our brains. But I didn't really sort of mention that we're also then shaped by experiences, and things happen. And I love how you were talking to me last time about sort of the emotional wounds that people experience, and the way that certain schemas might start to develop out of that. And I think we would see it very similarly in CFT, that people's early life experiences, especially their attachment experiences, and the sort of the attachment or relational tragedies or traumas or other adverse experiences and so on, definitely goes into, sort of feeds into the threat system, and how we then perhaps later on we become the version of ourselves that is highly sensitive in threat system, and starts to, see certain experiences, especially social relational experiences, as threats, and
Mm-hmm.
responds in ways that are about threat protection. And I think it's a really, I'm glad you sort of mentioned that, because yeah, the overcompensator, or the person who perhaps is very angry or aggressive and reactive in that kind of way, and often if we think about it from that evolutionary point of view, we can start to see that as threat system activation.
Mm.
That at some time in their life, and at some level even now, there's a kind of a sense of threat and lack of safeness, a sense of insecurity, a feeling of vulnerability, and those behaviors are really arising out of that threat system activation.
Yeah. Yeah. Wow. Okay.
The next bit is the drive system. And I think this plays into it as well, and perhaps in some of the work that you do, because the drive system is all about wanting, pursuing, obtaining, achieving, and it might be food and sex and those sorts of things if we think evolutionarily.
Mm-hmm.
But it's also to do with achievement and success, and competition as well. In some ways, the drive system might sort of put us in competition with others, and we can get into that zero sum game feeling of win and lose, and it's interesting because there can be harm towards self and others that arises out of the threat system, but also the drive system's tricky too. Sometimes harmfulness, or that sort of thing can arise out of that, and sort of before we know it, we're in a real kind of competitive motivation. There's this sort of hold and control sort of strategies that are coming out of that, and someone else has to, kind of sort of take the hit in a sense. And but the other problem too is that threat and drive systems can sometimes get into cahoots with each other too. And
Mm-hmm.
so the person's feeling very threat system activated, so they go to drive system, and that they double down on the competition, or they become perfectionistic, and sort of strive to be perfect, or various other ways that threat and drive start to work together in ways that can be unhelpful.
Mm. I can imagine what you're describing there with the drive system. It feels, and using schema language, it feels very much like the realm of the over controller kind of modes. The obsessive perfectionism type of thing, maybe self-aggrandizement. Sort of needing to be on top, needing to be the number one, needing to elevate themselves, maybe. Uh,
Mm. Mm.
yeah.
There's sort of terms like threat-based drive, or insecure striving, or those are the sorts of themes there, I think, where the person is at some level feeling threat system activated, and then kind of compensates for that with drive system
Mm.
activation. And it can be sort of a difficult combination, and I've been thinking, for example, about men in relationships who are aggressive or even violent and so on. And I think some of that can be conceptualized in this sort of a way, that there's a kind of a threat system activation in the context of the relationship. They're kind of fearing rejection or abandonment, perhaps, or they're feeling a sense of loss of control or vulnerability on that front, and they don't have sort of other skills yet. They haven't learned perhaps how to downregulate, how to manage the threat system. And so they move into a kind of a drive system. Sometimes it's me against you, or it's sort of becomes something more aggressive and violent. And of course, one of the difficulties there is that then society sort of shames them, and they've done the wrong thing, and you know and that shame then just feeds straight back into threat system activation again. You know, suddenly they're feeling no good and inadequate, inferior and unlovable, and it just sort of creates this really difficult cycle between threat and drive, I think, in those situations.
That's fascinating. You should use that example. I mean, one of our podcasts, I don't think we've done it yet, but we're going to look specifically at that issue around family and violence and domestic violence. And I mean, obviously, Shay is part of the panel that we have, and I know that she's done a lot of assessments and work with men in particular who struggle with violence in relationships.
Mm.
And what she's noted time and time again, this is obviously her anecdotal clinical observation, and there's some evidence for it as well, I think, within the literature, is exactly that a lot of these problems start from an attachment rupture. So it is precisely what you're saying. It's that sense, anxiety about being abandoned and not being able to regulate or communicate or even sometimes articulate what's going on, and they immediately, the pathway seems to be then to flip into this over controller dominator kind of role to try to, batten everything down, batten all the hatches down, even though they don't intend to wanting to hurt people, but they just can't regulate themselves. And that's where some of the violent behavior, problematic behaviors kind of sort of flow from. So fascinating, mention that example. But
it's a threat protection, safety seeking response with really terrible unintended consequences in a way, and it's sort of, and in CFT, and this is sort of interesting. I mean, I'd be curious if people listening have thoughts about this or comments about this, but in from a CFT point of view, we're then sort of thinking, okay, it's not their fault. This isn't their fault. It's their tricky brains. It's their life experiences. It's these past feelings, perhaps of attachment trauma or tragedy or relational difficulties and so on. And it's their threat system, and they're sort of, it's like an algorithm in a way, feeling threatened around relationship and abandonment, then react in this way to control and to overpower and to use aggression. And it's something that they haven't designed in the brain and have learned through their experiences. So it's not their fault. Now, a lot of people balk a bit at that.
Yeah.
And we'll say, well, it is their fault, or something like that. So that's why it's not their fault.
They should be ashamed.
But it is their responsibility. Yeah. So that's really interesting what you say there. If at all possible, I think CFT would be working towards how do we de-shame, sort of reduce shame and shift to something that is more like taking responsibility for their mind and for their behaviors and so on. And it's not about letting them off the hook. It's not about letting ourselves off the hook. It's about wisely, strongly, courageously approaching suffering and working out what is really most helpful here. What is it that I need to do that is helpful rather than harmful?
Yeah. I like the way you're conceptualizing that, Stan, because I know, obviously, in my experience, that shame in therapy, if that's where you lead to, or that's what clients have to sort of sit with constantly, then they never get any better. They never recover. They never move on. They never become functional and capable in ways that we would want them to be. And I think it's exactly that. Is how do we kind of in therapy separate, hold an individual accountable, but also not condemn them completely for
Yes.
what they might have done. And in schema therapy, I mean, I guess this is where there's a resonance that we don't hold them. We highlight that there is a side of them that struggles and needs to be on top or needs to take control. There's a side of them that reacts in response to a schema usually that's been activated, and an attempt to try to sort of down-regulate that emotion through this kind of way.
Mm.
Yeah.
Yes, there is
It is
a
a
resonance.
controversial thing. Like, I think
Yeah.
a lot of folks, I think, feel or think that this is actually letting people off the hook, but I
Mm.
would say it isn't really, because a lot of the time, in therapy, as you would probably well know, the hardest thing for folks in therapy is to look at this stuff with clarity.
Yeah.
And shame, I think, just means people block it, really, don't they? They just
Yeah.
or they flip it.
Shame just motivates us to hide away, to not want to think about it, to not want to engage on it. It's a motivator itself in a way, and it's to do with threat system. So when we're feeling shame, we fight, flight, freeze, or appease again, and so we're just now once again deeply ingrained in threat system. But the third emotion regulation system, the third circle is the in CFT we think of it as the green circle, but this is the soothing affiliative system. This is the part of our species that really did sort of, it's about closeness and connection and belonging, and about nurturing and kind of looking after and really it's about feeling safe and calm together, I guess, is the idea that when the threat is gone and our tummies are full, so to speak, then we can be in the soothing affiliative system. Then we can start to relax and feel safe and play or be playful and so on. The difficulty is, and I suspect in a lot of the work you do, and for me as well, various things have happened along the way that means that the soothing system or soothing affiliative system has been compromised in some way. And threat system has been, sort of exacerbated. And so people find it very difficult within themselves to feel a sense of calm, to feel a sense of safeness even. And often not even with others do they get to feel calm and safe because of what they've learned through their own experiences and trauma and so on. And so very often in CFT, the first step in a way is to think about how do we really develop soothing affiliative system. How can we start to sometimes just slowly, it can take a little while just for people to start to feel a real sense of safeness, distinct from safety. Safety
Same
is
order.
op- yeah, so safety is sort of a little bit more red circle, a little bit more of a threat system idea that I'm sort of seeking safety because there's threats out there. Whereas a feeling of safeness is a very kind of present moment feeling that I am now safe. And some of the analogies are things like when we're going rock climbing, for example, we might be in safety mode while we're checking the ropes and checking the carabiner and making sure we've got our helmets on properly and whatever. That's sort of safety. And then safeness, we're up on the side of the rock face, but now we feel safe, and we're there, we're able to look around and really experience the world and so on around us. So safeness doesn't mean hiding away and being kind of safe because we're away from everything. Safeness is a sense that I am now safe and I can go out and explore the world in a way. So we're really trying to think, how can we cultivate that soothing affiliative system? How can we help the person experience calmness and safeness? Because then when threat system is activated, then we kind of go to soothing system. Soothing system becomes kind of like a safe haven for threat system. and helps to down regulate threat, but then becomes a kind of a secure base as well to then, go out to healthy drive, go out to exploring the world and, having adventures and succeeding with things and so on. So we almost end up going that way around the three circles model. When the threat system is activated, first go to soothing system, calmness, safeness, then out to drive.
Oh, that's right. So the three systems, the threat system, the drive system, and the soothing system, they have a functional, I want to say, healthy aspect to them as well, don't they? So the degree of threat or the degree of drive kind of sits on a continuum, doesn't it? Like, I mean, what
Yes.
we're talking about, it's like if it's too much in the red zone with the drive or the threat zone, that becomes really problematic. But there is an element where you can be in those zones, and that's like a healthy green zone, for lack of a better term, right?
Mm.
Where you deal with a threat, or you take appropriate action to keep yourself or other people safe, right? Or you pursue goals that are useful and worthwhile, and that.
Yeah.
Right.
Exactly. I mean, we would say things like, the key is sort of finding balance across the three systems, and we're not wanting to get rid of anything, really, because I mean, threat system. I guess our modern world is a little bit different to 50,000 years ago in a way, but there are still threats there that we would want to be able to notice and respond to in helpful ways, and anxiety at certain levels is a bit of a motivator too. That we sort of helps us to respond to things. Drive system as well. There's definitely healthy drive. It's kind of a question, I think, sometimes. I don't know if this is a bit too sort of sort of low level or something, but like what is it that's running the show? I guess when threat system's really running the show, then we're wanting to try to manage that. Or if with drive systems, we're trying to see can we have soothing system, the organizing system, that's the one that can kind of reassure and soothe and down-regulate threat, as well as encourage and kind of, drive system in a sense. So in a funny sort of way, soothing system is sort of like the organizing system and keeps the other two in balance.
Yeah. Okay. And it sounds almost like compassion is sort of like this meta kind of, I don't know, concept or direction. I don't know. I'm not finding the right word, but it's like sits across all three of them in terms of like,
Great.
that's like it's the, it's the software, it's the running system on the computer, I guess, for lack of a better term. That kind of runs. So it's compassion. That's the approach or the reaction to whatever might be going on for you in each of those areas. Would that be right?
Yeah, really, really great, because sometimes, we can confuse compassion with just being soothing system, but it's not quite that either. It is across all three, and compassion itself can be textured with lots of emotions. Sometimes compassion might come along with sorrow, for what the person is going through, or sometimes righteous anger, or sometimes sort of anxiety, and sometimes it can be high in drive, the fire person who's racing into the burning building to sort of save people, and sometimes it might be something much more soft and gentle, like your little toddler's had a nightmare and you're going in to soothe them or something like that. And so we definitely we sort of integrate the three systems to help to work with that more overarching compassionate motivation.
Yeah. Wow.
Motivation, I think, is the word that perhaps you were searching for, and I say that because it is probably a key part of CFT. Is we really think of compassion as a motivation. It's not, compassion isn't a feeling or something like that, or in CFT it's not even really quite a value either. Like if you're thinking acceptance and commitment therapy or something, compassion is a motivation, and we can bring a range of things to that motivation.
And linked to that is the wisdom to know what is what is a compassionate thing to do in a particular
Mm,
situation with a particular issue, isn't it?
yeah. The wisdom to know what to do and the strength and courage to do it.
Yeah, I like that. So, Stan, tell us, how does this play out in a session with a client? Like, so you have a client coming in and they might be struggling with maybe self-criticism, or they might be struggling with, self-loathing, the variety of other things, or
Mm,
self-hatred, self-loathing. Like, how does this,
mm.
how does a CFT orientated or therapist, respond to that? How does that work? How does it play out in a session with someone?
Well, we sort of, in simple terms, have I guess two or three halves to that. The not that that would be halves, but you know what I mean. We've got the first bit, which is the psychoeducation, and so quite a bit of time is spent really on topics and so on that we've been talking about. The idea of evolutionary psychology and we have these brains designed for us and not by us, that we're born with certain strengths and weaknesses, and then we're shaped by experiences, and so it's not our fault, but it is our responsibility, and there are things we can do to take responsibility. So we're sort of pitching all of that. We're talking about the three circles model. We're starting to really develop mind awareness through the three circles model. And it's always exciting, those sessions with people where they come in and they sort of say, look, I just noticed I was threat system activated here and there and whatever. But when I did this, I got my soothing system going. Like, we're really trying to use the three circles as a way to develop mind awareness and understanding, and then starting to bring in a sense of, well, what is compassion then? How can we, how might we define it? What might we do to start to cultivate it? So there's a whole bunch of that psychoeducation, and then we get into various elements of compassionate mind training. So these are the more skills-based parts of CFT, starting with body-based practices using breathing and body posture and facial expression and voice tone to try to really develop soothing affiliative system to begin with, and then using imagery, bringing in imagery of calmness and safeness, and perhaps even imagery around a compassionate other and what that might look and feel and be like to imagine a
You be,
compassionate other.
would you be doing that in session with a client? Would you be the one leading that imagery? Would it be a
Yeah, definitely. There's another one of my favorite exercises really in CFT is called the compassionate friend exercise, which is really bringing all those body-based things in to begin with, getting into a physiological state that is sort of soothing affiliative system, and then kind of creating imagery around a place where you feel calm and peaceful and safe, and then a compassionate friend or a compassionate other comes to join you in that place, and sort of you spend time together and sort of savor the time together, and then every now and then the compassionate friend might say something to you that is just what you need to hear, right now in your life. The compassionate friend offers some sort of compassionate words of wisdom or strength or encouragement or reassurance or helpfulness and that sort of thing. And so
would
we're
that be
really,
something that you say, or as the therapist would maybe say, or is it something that you say? Is it more sort of like your compassionate friend says something that you need to hear? What does he say, or what does she say?
yeah. Yeah, see, it's so great because remember, the motivation of compassion is in us all
Yeah.
because it evolved as part of these brains that we're working with. And so when the circumstances are right, and the physiological and emotional systems are kind of online, then compassion just arises. And so we might just say, your compassionate friend says something to you now, something that is just what you need to hear at this time in your life. Just listen carefully to what they might have come to say. If nothing comes, that's okay, but just wait and see if they have anything that they'd like to tell you, sort of a thing. And the reason that it's one of my favorite exercises is because quite often the person's compassionate friend will say something quite profound, something
Mm,
quite helpful, something that captures the essence of something that they might actually take away with them,
mm,
and much more profound than anything I might sort of
mm,
say or
mm,
offer or whatever. It sort of really kind of captures something, and that's probably one of the little points about CFT is it really is about the guided discovery. That we have these various, all of this. There's the education, but even that we're doing in a guided discovery way. But certainly the compassionate mind training is creating exercises and experiential kind of aspects to therapy whereby the person discovers their own wisdom, their own strength and courage, their own compassion, and they can sort of then explore that and work out ways to apply it as well.
mm, mm. Okay. Um, what about with clients? I mean, I'm thinking of some clients that I've seen where, like, we do within schema therapy, we do imagery rescripting, or we will, um, sometimes have their vulnerable child mode in the room, and we'll try to connect with them, or we'll try to sort of soothe that part of them. And we have this issue of punitive or very critical sort of modes become very, very big in the session.
Mm,
And some clients can get really fixated in that state. They can just say, I hate that part of me, and I'm a horrible person, and that part of me, or the vulnerable part, the part that feels pain, the part that had trauma, is dead to me, that type of thing.
mm.
I mean, that's pretty harrowing, as a therapist to kind of have to deal with in the moment. And I'm thinking, like, how would you deal with something like that if the client, when you're doing this, and they flip into the part of them that just kind of really, becomes very angry with themselves.
Mm. Yeah.
How is that kind of dealt with in that situation?
Yeah, well, a few thoughts come to mind. I mean, the first thought is that it's often quite useful as the therapist to think about the sequencing of things. And so we are really beginning in some of those experiential exercises to develop a sense of the compassionate other or the compassionate friend, but also a sense of the compassionate self. When I'm in that compassionate self mode, if you like, what is my body posture? Like how does my face look? How do I move in space? What are some of the thoughts and feelings and sensations that arise when I'm in that compassionate self, and then becoming more and more familiar with what it's like to step into the compassionate self, and then from there we might start to explore some of these other parts or these other selves. We in CFT we are thinking about multiplicity and the multi-mind and the fact that there can be these sort of different multiple selves that we're working with. We might begin with the anxious self or the angry self or the sad self, and then we might move towards the critical self or the shamed self, and sort of using imagery, as you say, using chair work
All
to
right.
work with those multi minds.
So the imagery, you would have the helpful, kind, wise friend in the image, and then the part of them that's the critical, the criticized, vulnerable part as well.
Yeah, so
All right. So yeah.
uh,
Okay.
we might absolutely be sort of using imagery to imagine, there they are as their wise, strong, courageous, compassionate self.
Yeah.
And in front of them is their vulnerable, shamed self. Maybe we might work with the young child version of that shamed self as well.
Mm.
We might imagine the critic, though, too. And so, yes, definitely through imagery exercises where it's pretty similar, I think, in a way, isn't
Yeah.
it, to what
Yeah.
you're doing? It's trying to, but I suppose in CFT, it's that real focus on bringing compassion to each of those aspects of the self. So even the critic would be, sort of what is it that the critic needs? What would be helpful there? Obviously, the self-criticism is kind of threat system activating and perhaps even causing harm, but we're bringing compassion to all those different aspects of the person. And the chair work stuff too, I think a bit like schema therapy chair work, we would be using chair work in CFT. One of the ones that sparked in my mind a moment ago was, as you said, that, and this was really big for me when I kind of realized this or something, but we have the critic, we have the critical self, but we also have the criticized. As you said, there's the part of ourselves that's on the receiving end of that criticism, and often that part of us, gets very little voice or ability to sort of express itself and so on. And so, using chair work around the critic and the criticized, the compassionate part, exploring things with both parties, becoming a bit of almost like a negotiator or a facilitator or something, and sort of working with self-criticism, I guess, in that kind of way.
Oh, wow. Are there so if clients are working with you, you mentioned before you do some imagery and some compassion focused exercises. So what would homework look like for someone perhaps who is doing CFT? What kinds of things would they typically ordinarily do between sessions, maybe?
Yeah. Well, I think early on they might be working with the 3 circles model
Yep.
and doing kind of monitoring of 3 circles. Like you might use the 3 circles to identify, where you're at in a given moment, but you might also start to think about the 3 circles over time and how those different circles are shifting about as, across a situation. Or you might think about the 3 circles in context. What are the different contexts and how does that influence, my 3 circles? Monitoring too, getting caught up in loops of the mind. So our threat system might be activated by something that happens perhaps externally even, and then we bring it internal by bringing in the catastrophizing or the ruminating or the self-criticism, and we get caught up in those loops that maintain threat system activation. So there's quite a bit of that sort of monitoring, use of the 3 circles model and so on at the beginning. There's usually practice, homework practice of soothing rhythm breathing exercises or imagery exercises. I certainly tend to, CFT therapists would tend to record those exercises in sessions and send the people home with certain recordings and that sort of stuff. But eventually, the homework is really about sort of exploring and planning embodiment of the compassionate self. Like what might the person do, sort of with their bodily sensations, but their sort of their posture, their kind of behavioral urges and actions. How can we actually embody that compassionate self? It takes a lot of practice to, you arrive home, it's 5 o'clock or 5:30. You know that inside, it's happy hour with the kids or whatever, and you stop at the door, you roll back the shoulders, you lift the chin, you take some soothing breaths, you kind of connect with compassionate wisdom and strength and courage and whatever, and you just spend a few minutes to really try to embody that compassionate part of you, and then you walk through the door and you go into the chaos, and you're just sort of starting to really practice it. I like the idea that in CFT, we learn about the compassionate self, we then practice the compassionate self, and then we embody the compassionate self, so that as things do arise, life difficulties arise, so too does that compassionate part of ourselves, because we're just sort of embodying that in response to various things.
I love it. You may just have answered this question, Stan, but I'm going to ask it anyway, because I know a lot of our listeners are therapists working in forensic environments and with forensic kinds of issues. And I'm sure they'd be interested to hear your insights in terms of what's 2 things, right? How can they perhaps prevent burnout working in these kinds of populations? and how can they maintain their compassionate focus or mindset or way in environments in forensic environments, which can be very challenging and stressful and the complete opposite of compassion, I guess. Any thoughts about that would be great.
It's a big question.
I know, sorry,
Um,
Dan. We
and
only ask the big ones here on this podcast. We ask the biggest.
But it's a good
10
question.
seconds.
It is a good question because uh, therapists like us and everyone have kind of tricky brains too, and that were designed for us, not by us. And as you were saying, you sort of used words like stressful and challenging and so on. And another way of thinking about that is that to be a therapist in forensic populations with forensic populations means your own threat system is going to get activated at times. You'll have the threat system that kind of starts to sort of activate and go off, and then the drive system will kick in because you think I must be a good clinician, so I'm going to try harder, and you're getting caught in some of that same stuff really that we were talking about before. And so, in many ways, I suppose I think I mentioned this at the start, but it's probably relates here as well. I haven't really talked about it much, but just that idea that compassion is across three flows, and it's
Mm,
across three flows for our clients as well. And so there's that sort of focus, which would be interesting to think about from forensic populations points of view as well. But it's really relevant for therapists too. That we're sort of trying to get balance here, that we're able to be compassionate towards our clients and the people we're working with, that we're able to open ourselves up to receiving compassion from others around us, our colleagues, supervisors, and perhaps people in our personal life. And we're able to maintain that self-compassionate flow as well, that we're able to notice and be sensitive to our own suffering and be committed to doing things that might help to alleviate and prevent it. So I think the biggest thing there that occurs to me is just how we manage and keep in balance those three flows of compassion. It's interesting with therapists because even myself, like one of my colleagues might say to me, oh, Stan, looks like you've had a pretty big, busy day, how you going? You okay with all that? And I'll be like, oh, yeah, I'm fine, no problems, or whatever. Sorry, that was a bit high. But like we
very
sort
well.
of block it, we find it really hard to receive compassion. We feel like, oh, but I'm a therapist, like I should be strong. I should be able to just maintain compassion for others. Like
Mm,
I don't really deserve receiving it, or I don't deserve my own compassion sometimes, and actually, that's the other thing that's really key to mention probably here is the fears, blocks, and resistances to compassion. And therapists experience that too, that we worry that if we open ourselves up to receiving compassion, that people will see us as weak or soft, or they'll think we're not a good clinician, or that we're not coping well enough, or we have these various fears, blocks, and resistances, and so we kind of shut down to others' compassion, only to then suffer more, and sort of wear ourselves out. The other thought too, which I'd put to people is, there's a bit of a debate around about, is it compassion fatigue, or is it empathy fatigue? And
mm,
and and sometimes what I think is interesting to contemplate is, what when we're working in these fields, we're spending a lot of time and energy basically resonating with the suffering of those that we're serving and those that we're working with. And when you empathize and resonate and kind of when you're in that position, especially when it's hard to get any outcomes, when it's hard to know quite what we can do here, when the action part of compassion is a bit blocked by the system or by the whatever we're facing, but the sensitivity and the empathy and all of that is just going full pelt, then that's, I think, what creates the fatigue and the burnout and so on. And, because compassion is an algorithm, it's the sensitivity to the suffering and the taking helpful action. And so just noticing that the sort of the subtle difference there, and it's perhaps the empathy side of things that really starts to wear us down, especially when there's not things that we can really actively do to remove the suffering.
Wow. I have to say that I really resonate with what you're saying now that we're using the word resonate. But yeah,
Mm,
I can really see that how empathy, how that is in a forensic context is exhausting. That if you're
yeah.
doing this 24/7, then you can, if you don't have any kind of way of kind of managing that or trimming that down, then you will be burnt out and exhausted. And I
Mm,
can see how that's actually quite different in sort of a felt sense from this idea of compassion, right?
mm,
You can almost kind of learn how to be able to titrate the empathy to the trauma, so that it
mm,
doesn't overwhelm you or exhaust you. But compassion, you can always hold compassion for someone's situation perhaps, and that feels like it's not as exhausting, holding compassion, I think.
mm.
I don't know, that's just as we're talking about,
Yeah, it
it
reflects.
feels like doesn't feel as hard once you kind of able to connect with that, to hold the compassion, but the empathy is the bit that can be, that's good.
Paul would say that there are six competencies, if you like, that we bring to compassionate engagement, and they kind of all help each other. So there's sensitivity, there's the sort of the noticing and the awareness. Then there's sympathy, which is feeling kind of moved by what the person's going through. Then there's distress tolerance, which is managing our emotional response to what they're going through, and kind of coping with that, and not letting it tip too far into personal distress. And then there's empathy, which is sort of understanding where they're coming from and perspective taking, but also that affective empathy of really resonating with the feeling. And then from there, there's non-judgment, sort of no blame, no shame, non-condemning, as you said earlier. And then there's the care for well-being, that basic caring motivation that sort of, and all of those six are sort of competencies that we can think about in terms of, what are the, which bits in amongst all that can I focus on or work on or really develop to bring those competencies to my compassionate motivation. And sometimes it is the empathy. Like, let's sort of have a think about that. Sometimes it's the distress tolerance, though, and being able to manage those personal feelings that arise when doing the work.
Wow. And what's that called? It's Paul Gilbert's six competencies in.
Yeah, he thinks about compassionate engagement and compassionate action.
Hmm.
And compassionate engagement has these six competencies, six skills in a way that we then bring to a compassionate motivation. And in a way, empathy is one of the competencies that we
Yeah,
might
yeah.
bring to our compassionate engagement.
I like the way it kind of breaks it down, because it feels like that, it captures something of the experience of being a therapist very, very well there, I think, or
Yeah.
part of it.
I mean, the one that often people notice and wonder about is sympathy. Yeah, because people have often sort of felt, empathy good, sympathy bad, or something like that. And there's a rather famous Brené Brown animation that sort of depicts this idea that empathy is really good, and you're sort of there with the person and walking in their shoes and so on. And sympathy is, hey, do you want a sandwich, or something like that? And as much as I as much as I love Brené Brown and her work, I don't approve of this particular animation, because that's not what we're talking about when we say sympathy. We're talking about a lighter touch thing, a kind of feeling moved, feeling touched by what they're going through. And empathy is really understanding the experience of the other person, but sympathy is an experience of our own that we have in response to that person's suffering. And often the sort of the empathy plus sympathy is what then moves us towards compassionate action. And then the distress tolerance is key because we're managing, our own feelings. So I do like those six, and I agree with you. They sort of capture the sort of the different components that therapists are really thinking about, and also how the whole is greater than the sum of its parts in a way. They work really together. But these same competencies we might bring to our clients as well, in terms of them developing their own compassionate selves.
Stan, we better finish up. It's been absolutely great chatting to you today, and thank you so much for coming on the podcast. I certainly, as a schema therapist, have been very interested in compassion-focused therapy, and I'm very glad we had this conversation. I can see that there's a lot of overlap, and a lot of and our conversation has really made me think about some of these concepts in terms of, how they practically relate to, some of our core concepts within schema therapy, such as the healthy adult mode, and also, learning to become, being a good therapist in terms of our clients, because within schema therapy, a key intervention is the limited reparenting, and in the role of therapist as a limited reparenting, using that technique, is wrapped up this idea of obviously compassion and helping the client be able to sort of meet their sort of emotional needs. But there's wisdom and about what that is and how to do it and how to respond, and there's courage in terms of kind of being able to stay the course and also not kind of push over things and be able to respond, I think, to some of the challenging modes that we would say that we experience or confront in therapy. So this has really given some good food for thought, and I hope that other schema therapists will be able to benefit from this great conversation as well. Stan, I know you do a lot. You've got your podcast, Compassion in a T-shirt, which I encourage folks to check out. Can you recommend, are there resources or places people can go to learn more about what the work that you do, or read more about compassion-focused therapy?
Yeah, well, definitely love people to come and check out Compassion in a T-shirt. There's various lots of guest interviews there, but also little video essays about topics related to compassion and CFT. I do have a book, Lars, The Gifts of Compassion.
You do, yes, as well. Sorry.
But so that's available on Amazon. It's a kind of it's sort of a self-help or therapy, adjunct to therapy type of book, if people are interested in that. The big book of CFT is Paul Gilbert's The Compassionate Mind. And that is a book that's really rich with integration and scientific and also wisdom traditions all being brought together to talk about this idea of compassion and so on. And there's another book called The Compassionate Mind Workbook, which was written by Chris Irons and Elaine Beaumont. And that's a really great sort of practical interpretation of Paul's work as well. The Compassionate Mind Foundation is probably the last thing I'd mention. That's Paul's foundation in the UK, and that has a lot of great resources and so on. They have an annual conference, which is October 6th to 9th this year. And so if people are interested, there's that as well.
Oh, wow. Excellent. Thank you very much, Stan Steindl. It has been wonderful having you on the podcast.
Always good to chat. Thank you.
Get hands-on experience with schema therapy at the Forensic Schema Sessions live training. Visit psychclinic.com.au/workshops for more information.